Good day, everyone. Today, we want to discuss snake bite and what the first aid services to render to any patient in our home, in our environment, in our neighborhood, in our community that is bitten by a snake. Snakes are elongated, they are limbless, they are carnivorous reptiles of the suborder Serpentes. Like all other squamates, snakes are ectothermic amniotic covered in overlapping scales. Having said that, what happens to an individual who is bitten by a snake? There are several things might happen at the site of the point at which the individual is bitten. There might be swelling, there will be redness, and there will be numbness at the site of the bite of the wound, and it might be with bleeding or without bleeding. And most importantly, the patient will be anxious and there will be wound at the site of the bite. So what do you do when this issue happens? This issue is a severe condition in which, if the patient is left uncared for, might result in the death of the patient. You have to ask the patient to keep calm and clean the area thoroughly with copious, soapy, clean water. You have to wash the place profusely, and if you have anti-snake venom, at that point, you might give anti-snake venom to the patient. Or if it happens in your community or your home, quickly arrange for a transportation to take the patient to a nearby community health center. Also, findings on examination, there might be tenderness at the site of bite with or without bleeding. And these are some of the symptoms of venom poisoning. The most important, so many people advise that you might use tourniquet the point of a little higher above the point of the snake bite. Some people advise against it, but personally, I would say the patient should remain calm and should be immobilized and has to lay low, and water should be used, copious water should be used to wash the place profusely, and then profusely in order to prevent the bite from climbing to the heart of the patient, which may eventually lead to what we call dizzying. The patient might involve in dizzying, and also low blood pressure, which might eventually lead to shock and death of the patient. And when this happens, and you arrange for a transportation to take the patient to a uh, a community health center in which necessary medication will be given to the patient, and you just have to remain calm